Good morning. My name is Sherman Lee Sr., and I am the proud mayor of the seven-time All-American City and first ever Hall of Fame inductee, Roanoke, Virginia. I'm sorry we are unable to gather in Denver, but excited to join you here from our market building located at the site of the oldest continuously operating market in the Commonwealth of Virginia. Ordinarily, we would begin this presentation with a marching band, a choir, cheerleaders, or something similar. We do know how to throw a party. But we recognize that these are not ordinary times. And for us, that just doesn't seem right. We do have reason to celebrate. We are a vibrant urban center set amongst the beauty of the Blue Ridge Mountains, a hub of health, care, and biomedical research and cultural center for Southwestern Virginia. We are also a city with its share of challenges, poverty, inequities in healthcare outcomes, and struggling families and neighborhoods. It is these examples of our community coming together and addressing challenges head on that we want to celebrate. That is, after all, what an all-American city does. We look forward to sharing with you how we have together built a culture of health and well-being here in our Star City. Thank you for this great honor to be among so many communities working so hard for their residents. Let's start with a quick video overview, then move to our presentation.
Nestled in the heart of the beautiful Blue Ridge Mountains, Roanoke is home to 100,000 residents. We're a hub for innovation, and we're known for world-class healthcare and biomedical research. Our city is diverse, rich in culture, welcoming, and compassionate. But like all cities, Roanoke has faced challenges as we strive to combat poverty and improve health outcomes. The community has come together to tackle these challenges in a collaborative and comprehensive manner.
The Hrv Pathways Hub is community empowerment. It's being able to go to someone that you know is truly part of your community, sit down with you, knowing your background, be able to help you navigate the services and getting better care for yourself.
Access to healthy food enables healthy lives, but some still lack access to fresh fruits and vegetables. That's where the LEAP neighborhood mobile markets and financial support come in. LEAP allows folks to stretch their dollar by doubling SNAP, EBT, or WIC benefits while bringing fresh food directly to local neighborhoods.
I've been coming here ever since March. It's all fresh and healthy, fruits and vegetables and bread and cheese and all kinds of other stuff. It supplements me coming to the grocery store, but it also is very community oriented. That keeps me coming back.
But healthy residents cannot prosper without safe neighborhoods. One example of efforts on this front is the Community Solutions Center, which transformed a building once associated with crime into a flourishing neighborhood hub.
Today we are able to help children eat out of the center. We operate a meal production training program for adults, which actually helps them get a foot into the culinary industry. We actually have community members that come into this building and can utilize the space for meetings that help with systemic issues that are happening right here in this community.
This collaborative community approach has advanced our local health culture and engaged our residents, working together to ensure Roanoke is not only an all-America city, but also a healthy community.
Good morning. I'd like to discuss my role with the United Way of Roanoke Valley, Healthy Roanoke Valley Pathways Hub program, which helps those at greatest risk receive coordinated care. I am Antoine Callum, the Hrv Pathways Hub manager, and alongside of our neighborhood-based community health workers, we work with clients to complete a health, social, behavioral assessment, and then guide them through a pathway of coordinated services leading to improved health outcomes. What starts as a visit to a clinic or cane often turns into a community health worker securing disability benefits, a primary care physician, and transportation to medical appointments. What begins as an ER visit turns into a community health worker securing transportation to a pharmacy to pick up prescriptions. Through these types of interactions, we are able to help clients address true issues they face and improve the health outcomes for them and their families. In just a few short years, more than 250 clients have been assisted creating over 500 pathways to better health, resulting in more than 365 referrals for services, over 400,000 worth of prescription savings, 67% reduction in ER visits, and access to healthy food options, which Maureen will speak about. Thank you.
Hi, I'm Maureen McNair-Best, Director of Local Environmental Agriculture Project, Hrv. In Roanoke, I'm fortunate to work with partners who employ social determinants of health lens, just like Antoine in the Hub program, and who understand that health is more than clinical care. Despite the amenities and beauty of the area, not all people in Roanoke have the same lived experience. Families and individuals live in neighborhoods where there's little or no access to fresh food. Seniors, even more so during the pandemic, have limited transportation to get groceries, and food, especially produce, is expensive and out of financial reach for many people. To address some of these challenges, LEAP has worked closely with community members to design and evolve the mobile market. In neighborhoods where there aren't full-service grocery stores, the mobile market, a farmer's market on wheels, makes weekly stops at Head Start centers, low-income senior housing, and clinics. When available and affordable, people use their tight food budgets to purchase fruits and vegetables. Almost 60% of all purchases on the mobile market involve a nutrition incentive. In the words of one resident, the market and incentives, quote, enable me to purchase the local farm fresh produce that I love to eat and to enjoy high quality nutrition that I could otherwise not afford. The mobile market is directly connected to and supports other important food access programs in Roanoke, including Curlion's Urban Farm, the Library Feed and Meat Program, community gardens, and Virginia Cooperative Extension Nutrition and Garden Education. Together, we have made real change through a systems approach. 96% of participants using incentives increase their intake of healthy fruits and vegetables. More than 70 residents grow food in community garden plots. Fresh food prescription programs reduce BMI, high blood pressure, and A1C levels. And since 2014, more than 90,000 meals, healthy meals, have been provided to area youth, thanks in large part to the work of Cheryl and her team at the Community Solutions Center.
A notorious nightclub, once the highest crime location in Northwest Roanoke, transformed into a facility providing meal production training program to unemployed and underemployed adults, as well as a community meeting space and an outreach space for Roanoke police to strengthen relationships between the police and the community. Good morning. I'm Cheryl Mosley, and I am the director of the Community Solutions Center. Before it became a high crime nightclub, the location that is now the CSC was once the home of an iconic family-owned business. Years later, after the property was sold and fell into disrepair, Roanoke Police Captain Rick Morrison rallied members of the community to come together to try to find a way to take back the property. With time, hard work, and dedication, a partnership was formed between members of the Northwest community, Feeding Southwest Virginia, the City of Roanoke, Food Lion, and Roanoke Police. And the Community Solutions Center was born. Not only is the CSC providing students with solid career opportunities, it is also feeding hungry children in the process. Students enrolled in the CSC's meal production training program prepare hundreds of meals per day that are distributed to at-risk youth in Roanoke City's after-school and summer feeding programs. The CSC's focus on fresh, locally prepared meals for those in need helps address the link between good nutrition and healthy communities. As one of our graduates said, in this program, you learn to incorporate new skills, work as a team, and help the community all at the same time.